The Department of Health recently launched the Chikiting Ligtas Supplemental Immunization Activity to vaccinate all kids and tots nationwide, as well as focusing more efforts to increase the immunization rate of the country. Ryan Lisigas has more.
The Philippines ranks 5th in the world with the highest number of unvaccinated children in 2021 and 2022. To boost the immunization rate of the country, the Department of Health, World Health Organization, United Nations Children's Fund, donor governments, and the private sector joined together for a stakeholder summit. The health department says 58% of the children are zero-dose or did not receive any kind of vaccine, which is the primary reason for lockdowns and restrictions due to the pandemic.
Bago magpandemya sa ating bansa ay bumababa na rin, pero lalong sumadsad dahil sa pandemya sapagkat yung mga restrictions hindi mailabas ng mga magulang yung bata at madalas sa health center kasi naka-lockdown tayo.
Just recently, the DOH launched the Chikiting Ligtas Supplemental Immunization Activity to catch up and vaccinate children in the entire country from May to June this year. Of the agency's target of 9 million children for vaccination against measles and rubella, 84.28% or more than 8.1 million received their jabs, while 81.92% or more than 2.3 million children were vaccinated against oral polio. However, it would be better if aside from the catch-up immunization, routine vaccination will also be practiced, in which parents bring their children to vaccination centers.
Hindi sapat na libre yung pagbabakuna, dapat makumbinsi natin yung mga magulang na yung mga bata ay dadalhin na kusa sa mga health center sa tamang panahon.
The DOH adds that budget on immunization program should be increased and included in the PhilHealth coverage. The participation of LGUs is also important.
Knowledge gaps will be bridged through the provision of updated policies and standardized training regularly rolled out for all of our healthcare workers.
Further, fighting misinformation spreading in social media should also be prioritized.
We must battle misinformation with active risk communication, and we should build local champions or representatives who will advocate for immunization.
The UNICEF is ready to assist so the Philippines can reach its vaccination target to curb the number of deaths due to illnesses that can be prevented by vaccines.
Kapag po mababa yung coverage ng pagbabakuna, maaari pong ang mga batang ito, tinatawag natin itong susceptible to vaccine-preventable diseases, maaari pong magkaroon uli ng outbreak.
One of the suggestions of UNICEF is having more outreach immunization services to vaccinate children in far-flung areas, urban poor communities, and communities in conflict. At the Immunization Summit 2023, Health Secretary Ted Arbosa asked for everyone's cooperation to bridge the immunization gap in the country.
We intend to address those gaps through immunization acceleration plan, where there is a need to support. If there is one thing that we have learned from our COVID-19 experience, we can make the impossible happen through a whole of government, whole of society approach. Everyone has something to contribute to this endeavor through your own expertise and resources.
Ryan Lisigas for The Nation.